So, good morning, everyone. My name is Liesbeth Vandam. I didn't understand how I was introduced because of the language, but I'm responsible for the support to policy team at EUDA. I would like to thank the organizers for inviting the agency to be present at this event. And what I will be doing today is presenting the new agency, the EUDA, because we changed in July from the European Monitoring Center for Drugs and Drug Addiction into the EU Drugs Agency. At least the name is much easier to pronounce now. And what I will be presenting is how the EUDA now has a greater capacity to respond effectively to a more complex and rapidly changing drug phenomenon. So in this talk, I will illustrate how the drug situation has changed over the last 30 years since the EMCDDA was established. We now see a much more complex and rapidly changing drug situation. And I will also give some examples of how the new agency is better prepared to respond to the changing drug situation. So let me start with some of the key messages for this presentation. Our director likes to say that today drugs are everywhere. Almost everything can be a drug, and everyone can be affected directly or indirectly. When we say drugs are everywhere, it's important to think about all the complex policy issues that exist. For example, mental health policies, drug-related violence, homelessness, and how the drug situation has an impact on these. Everything can be a drug because everything with psychoactive substances can appear on the market, and everyone can be affected. And that is obvious, for example, in the phenomenon of drug-related violence that we now see increasingly happening in many EU member states. Another key message is that the market is characterized by a wide availability of a broader range of drugs, often high potency or purity, or in new forms or mixtures. And what is one of the main drivers behind it is that we see increasingly commercial infrastructure, commercial transportation infrastructure being used by criminal groups. When we look at the number of seizures, we see that 70% of all the seizures comes from EU ports. Initially, we saw this primarily at big European ports, but we also now see smaller ports being affected by this. Of course, what does that mean for people using drugs? People using drugs, they are now at an increasingly risk to experience health problems. Why? Because of the more complex patterns of use. We see much more polysubstance use, and also because sometimes people who use drugs might not be aware of the actual substances they are using. So what is really obvious over the last decades is that there is a need for enhanced toxicological and forensic data to inform better policies and actions. Let me say a few more words about a higher availability of potent drugs. We see that among the traditional substances, the availability remains high, but we also see that now the market of the new psychoactive substances is integrated in the more traditional market of illicit substances. So there is a widespread availability of a broader range of substances, and they often appear at high potency, high purity, and also in new combinations, new mixtures, but also what is really challenging is that the scientific knowledge and the health knowledge is often very limited. We also see a growing diversity in different forms and routes of administration. And as I mentioned earlier, this really has important implications for people who use drugs because of the complex patterns of use, polysubstance use, the implications actually not known what it means for health, but in particular because often people are not aware of the substances they are consuming. An important driver, in addition to trafficking through the ports, is also because Europe is a significant producer of synthetic substances, and also there we see an increasing complexity. While traditionally we had laboratories that were producing amphetamine, methamphetamine, MDMA, we also now see cocaine and heroin laboratories, and also sometimes these laboratories, they produce different substances, and that's really something that's also changing from that point of view. We also see how, let's say, how adaptive the market is. We see innovative production processes. We see seizures of chemicals for making precursor chemicals to manufacture synthetic stimulants. And this very often doesn't make it very easy from a regulatory point of view. Like who would be the responsible to intervene. So this creates challenges for customs, law enforcement, and existing regulations. There's also a public health dimension to that. We noticed that there were, in 2022, almost 200 drug production waste dumping sites detected in Europe. Polydrug consumption and drug mis-selling, they are indeed increasing the health risks, and that's also an important characteristic of the current market. We see that polydrug consumption is, let's say, the norm these days. And the substances being sold, they can contain more or one or more substances, but they can be sold as mixtures, but they can also be sold as replacements. And again, users being unaware what they may be consuming. And some of the particular concerns that we have seen is cannabis products, sometimes low THC cannabis products, then being adulterated with synthetic cannabinoids. We have seen MDMA products sometimes containing synthetic catechinones, and these are some of the concerns that are very important in that context. Then another, let's say, characteristic is if we look at the drug-related deaths, we see that there's often multiple substances available in most opioid deaths, and opioids, they are involved in 74% of the overdose deaths in the EU, but they are usually found together with other substances. So yes, polydrug toxicity is common. Illicit opioids are being found together with other illicit drugs, medicines, and alcohol. And what is also important is also that we see an increase in the role that stimulants play in that area. And again, it would be very important to have better information, also to better understand the most dangerous combinations, the interactions between substances, and so on. We also have data coming from syringe residues analysis, and also there we see a greater diversity, multiple substances being injected. Something that you may have heard already is the appearance of nitazene opioids already associated with harm in some countries. Of course, in Europe we have been looking quite a lot of what's happening in the US and Canada with the opioid crisis there. And this does not seem to be happening in the EU. However, there are some indications that we also need to be prepared. One example there is the role of the nitazene opioids. They have been reported for many years already to the early warning system. And they may be sold in preparations that resemble heroin, so again creating a big risk for people using heroin or thinking they're using heroin. They're sometimes missold as medicinal opioids, and there are notifications to the early warning system in fake medicines containing nitazenes in an increasing number of member states. We've seen in Ireland in 23, 77 overdoses in 2 cities, and also some prisons were particularly impacted by nitazenes. What is really an important development is what's happening in Afghanistan, because Afghanistan has for many years been the main supplier of heroin to the EU, and there was a Taliban opium cultivation ban in April 22, and we are still, let's say, really very much looking at what the impact might be on the EU. And because there was a previous ban in 2001, and what we've seen then is that some stimulants and some synthetic opioids became replacement drugs back then. Some stayed. In other countries they went back to heroin after the ban. However, what we have seen so far is not yet a major impact, also because there were stocks available in Afghanistan. However, the prices over the last years have very much increased. So there's many uncertainties in here. For example, it's unclear if the current opium ban will be sustained over time. The most recent report published by UNODC 2 weeks ago on Afghanistan showed that the cultivation was still much lower compared to before, but there was again a slight increase in there. So yeah, of course, some of the concerns are adulteration of heroin with new synthetic opioids, mis-selling of new synthetic opioids, replacement of heroin by new synthetic opioids, and so on. But this is time. We will see what will be actually happening. And countries need to be prepared, for example, to increasing access to opioid agonist treatment, support needle and syringe programs, and increase naloxone access. So this is an important development. So what are the specific challenges resulting from the increased availability and use of synthetic drugs? So we are now faced with monitoring an ever-changing and growing list of substances, mixtures, and chemicals. In that context, self-report data becomes less useful. And at the agency, we need to invest in approaches that can perform better in monitoring and responding to polydrug use consumption patterns. So we need greater forensic and toxicological capacity to monitor trends in availability and use. So we need an underlying information model that is both scientifically robust and comprehensive, but also agile enough to respond to emerging threats. So in July we became the EUDA, and just a few words about what that means in terms of the work that we are doing. The regulation is organized around 3 pillars: monitoring, preparedness, and competence development. So what are the actual changes for the work? So the monitoring capacity got extended. We will be developing a new threat assessment and alert system. We're very much in the process of developing these. There will be a more important role for futures and foresight exercises, developments of more rapid methods that would allow us to get more timely information about the drug situation. A new network of forensic and toxicological laboratories is needing, reflecting the challenges of polydrug use. And the regulation also put a stronger emphasis on an international focus. So this is the underlying integrated knowledge systems model. So if you see, we need to create an evidence-based through monitoring and surveillance. We need to increase preparedness and then incorporating foresight and future exercises. But also by incorporating foresight and future exercises, we'll also, again, be better prepared for anticipating what will be happening. We have a very strong base on the monitoring and the surveillance. Over the last years, we started developing the preparedness, but it's primarily the preparedness element and the futures and the foresights that the new agency will be focusing on. Of course, we don't start from scratch. We are building on 25 years of monitoring the drug situation. But back then, when the agency was established, this was very much a focus on the heroin and the HIV epidemic. 5 key indicators were developed in the early years of the EMCDDA, but gradually new data and information sources were developed. Just to give a few examples there of how we will be able to report more in a timely manner is through collaboration with external networks. Co-production will be a key term for the new agency. So just to name a few, building collaboration with the SCORE group, which is wastewater-based drug epidemiology, which will allow us to get information on changing drug trends in a really rapid way. Working together with a network of hospital emergency rooms, the syringe residues project that I mentioned already. So co-production with external expertise will help us to be more timely in our analysis of the drug situation. We started with the European Web Survey on drugs and open source monitoring. And these more timely information sources, they will help us addressing the challenges of the rapidly changing drug situation and the more complex drug markets. And also these will help us to overcome the limitations with self-report data. At the moment, we are very much in the development of developing the new services. So we are developing the European threat assessment system. that would help us to get strategic insights into upcoming threats. Then simultaneously we are developing the drug alert system that would allow us to rapidly inform or to rapidly alert on risks happening in the drug situation, and this will be underpinned by a network of forensic and toxicological laboratories. And these services, these are being developed to support preparedness. Of course, we will be maintaining the essential ones, including a more timely monitoring of the drug situation. And with these new services, with this new integrated knowledge model, we will be meeting the challenges of a changing drug scene. And I think that's it. Thank you.